Welcome, everyone. I think we'll go ahead and get started, and I'll do some introductions before we get going. I also have a little bit of housekeeping and some background information, but let me just start by telling you who I am. I'm the Director of Systems Advocacy at Global Rights for Women, and on behalf of our whole team at GRW, I'm pleased to welcome you to our conversation today on safely consulting with survivors. Global Rights for Women works with partners in the United States and around the world to bring societal change through legal and systems reform to end gender-based violence. We center survivors' voices and insights in our work, and this is what makes today's topic so relevant. With the support of UN Women and Australian Aid, GRW developed a guidance document called Safe Consultations with Survivors of Violence Against Women and Girls, to further develop the confidence and competence of advocates, researchers, policymakers, and other leaders that want to and need to safely engage survivors to learn about their experiences with services and systems. As we begin, it is our practice to acknowledge the Indigenous people of the lands where Global Rights for Women is headquartered. Even though we are meeting in a virtual space, it is important for us to acknowledge that we have and continue to benefit from the theft and occupation of this land since even before the United States was formed as a nation. Global Rights for Women is located in Minneapolis, Minnesota, with staff throughout Minnesota, and acknowledges we are in Dakota and Anishinaabe land. And I'll add that I'm joining you from Huacuru and Perucu land in what is now known as Baja California in Mexico. If you'd like to enter into the chat a land acknowledgement from where you are joining us today, that would be most welcome. We recognize the historic discrimination and violence that has been inflicted upon Indigenous people globally. Additionally, we understand the treatment of Indigenous women is a byproduct of the colonialism, racism, and misogyny that has perpetuated the continued sexual abuse, disappearance, and murder of Indigenous women in Minnesota and in many places around the world. So we'd like to just have a moment of reflection to acknowledge that harm in the past and continued into the present. And for each of us to consider how we join the effort to dismantle the continued oppression of Indigenous communities and work to restore justice. So we'll just take a moment. All right, thank you. So thank you all for coming. It's my pleasure to host our conversation today. And just a couple of housekeeping things. We welcome your comments in the chat or in the Q&A section on Zoom. After the conversation, we'll send out a link with the recording. Now, on to our panelists. As you can probably see, we have a great panel with us today. They have rich and varied experiences, and they include leaders with whom Global Rights for Women has had the pleasure and honor partnering with on distinct and specific projects. I'm beyond delighted and pleased to introduce them to you, and I'm going to name each one of them and then have them say a few words about themselves as we get started. So I'd like to start with you, Amrithani Keefe from the Domestic Abuse Project. Welcome, and could you say just a few things about yourself?
Sure, I'm happy to be here. My name is Amrithani Keefe. I'm the Executive Director at the Domestic Abuse Project in Minneapolis, Minnesota. I'm a clinical social worker by trade and very much love group work and excited to be here to talk about focus groups with you all.
Thanks, Amrithani. Alicia Wallace, the founder and leader of Equality Bahamas. Welcome, Alicia. It's so good to see you again. And could you say a few things about yourself?
Hello, I'm Alicia. I am from the Bahamas, and I'm the director of Equality Bahamas, which focuses on ending gender-based violence, particularly centering women and LGBTQI+ people. And I'm also working as a consultant on a number of different projects that really focus a lot on research and also program development that come from centering survivors.
Excellent, thank you, Alicia. And Scott, it's a pleasure to have you here as well. Can you, Scott Miller with the Domestic Abuse Intervention Program, could you say a few more things about yourself?
Hi, I'm Scott Miller. I'm the Executive Director here at Domestic Abuse Intervention Programs, and I've been working here for 23 years. I was under the guidance of Ellen Pence, who started the CCR here in Duluth in 1980. And then we also work in CCRs in surrounding communities, south and east of here. So yeah, we have a lot of, most of what we do here is CCR work. So
Scott, did you want to say what a CCR is?
yeah, well, okay, so a CCR in a very quick way is like an orchestra, right? So you've got the string section over here, and they've got a whole different set of notes than the oboe section over here. But when you tie them all together, it sounds great, right? So all those policies, protocols, and procedures that we end up developing, that is the CCR. The CCR is not the meeting. The meetings take place within the CCR. CCR is the structure of what we've created in the community to tie everybody's work together.
That's great, thanks. And for people that might not be familiar, coordinated community response, right? CCR. And if you're thinking in those terms with coordination, this will also be a fantastic session, because hearing from survivors as a part of that process, as you're saying, of bringing the orchestra together is such a key part. So thanks, Scott. And now I want to have Melissa Skaya at Global Rights for Women introduce herself. Thanks, Melissa, and the key author of the guidance document. I had the pleasure to work on that with her. But and Melissa, introduce yourself a little bit, and then just go ahead and I think move into giving your overview as we have planned.
Sure, great, thanks, Laura. So I'm Melissa Skaya, Director of International Training at Global Rights for Women. I've had the great pleasure to work with all of the people who are on this, actually on all related to projects of engaging with survivors over the last few years. And so at Global Rights for Women, I also co-facilitate one of our men's, some people call them batterers intervention or perpetrator programs, but we also have a local program here in Northeast Minnesota. And then I also like to say that I was previously Scott's boss at domestic abuse intervention programs. I tried to boss him around, you know.
I will acknowledge it's a difficult job.
Yes, it was. He resisted a lot. I'm very, very happy to be here and to welcome you all to talk about this. So Sophia is going to put in the chat the link to the guidance. So one of the things that I just want to say to you a little bit about this guidance document is our time with you here today is not to sort of go over it, you know, piece by piece, but to highlight some parts and how each of our partners here have used this guidance. But we wanted to say a little bit about how this came to be. So this guidance document, the Safe Consulting with Survivors, came out of a number of sort of arenas and areas, but at Global Rights for Women, we were asked to do what's called an assessment of the essential services package. So for those of you that don't do international work, the essential services package is a set of guidelines for those who are doing violence against women work around the world. And 10 countries around the world were given money and the opportunity to try and implement these guidelines in a whole bunch of different areas. And then what we did is an assessment of the first 2 years of their implementation. And one of the biggest things that stood out from our perspective about the implementation of the essential services package is that a lot of countries made a lot of big changes. They made a lot of moves forward. But what none of them did is none of them talked to survivors, did focus groups with survivors or interviews in survivors in making those really big changes in their work. So we really saw this as a big sort of glaring gap. And so we had recommended to UN Women that this sort of guidance document be developed. And so that's how we came to be funded to do this. So there's a lot of names on this screen here. There are particular people who we say contributed to the writing. There are people who gave us opportunity to test out things. So for example, Amithany partnered with us in Minneapolis, and we were doing focus groups at the time while we were writing this and learning things. Same with our partner Kurland in Haiti about how to think about doing them remotely. And then most recently with Alicia in the Bahamas. But you can see just an acknowledgement of the number of people who really contributed to this guidance being what it is here before you today. So one of the things just to say, of course, is that when we think about this, we're really thinking about a survivor-centered approach. I also think that there is an increasing sort of recognition that survivors' voices really do need to be a part of the input. I see a trend going back to that more and more conversations in more technical assistance or trainings that I see being designed. And part of what we've come just to learn and understand is that we really want to think about how when we use this term survivor, often we all have the thinking about who a survivor is, and that's a problem, right? Survivors are diverse in their lived experience, in who they are, in who they engage with, who they don't engage with. And so when we use this term survivor, we want to just sort of set the stage for you that that's part of the point of this sort of guidance, is for communities to really think about the diverse needs of survivors of violence against women and girls, that when we create interventions, those interventions really have a big impact on their lives. The actions we take have a big impact on their lives. And that's not, that's not just one impact, it's a diverse impact in terms of what we've seen. And I think, a good example we've seen is, in terms of, for example, mandatory arrest policies. We never, when we think about that policy, what we see now is one of the unintended impact, particularly here in the US, of Black women being criminalized, Native American women being criminalized. So it's just one of the many, many examples about why we think it's so important for us just to sort of set the stage up when we say survivor. We really want to be thinking about the diverse needs of survivors who engage with our system. So when we've talked with people about engaging with survivors, consulting with them, including their input into the design of interventions, and just to learn from them, there are two big things that we have heard about why communities, countries, organizations don't. One of the big reasons we've heard is that they're worried that it would re-traumatize survivors. And so that's a big worry of a lot of people, to ask women to come and talk about their experience. We'll talk a little bit about that, but one of the things I just want to say right from the beginning is that most of what we've sort of guided people towards is not to have to talk about necessarily what they've experienced. Now, women can if they want to, but the process isn't designed to force women to. It's more about their having this experience and then thinking about, who do they consider as helpful in the community? Who do they see as a resource? Or what was their experience with this intervention or agency? So we want to be clear that we're not saying to require survivors to talk about what they went through. Now, some survivors do, some survivors will, some survivors want to. We also have a diverse experience in that sort of way as well. And then we've also had experiences, of course, where for some survivors, it's the first time they've ever talked about the experience. The second reason why this guidance was created is because what we heard from a lot of communities is they said, well, that's great, but I don't have the foggiest idea about how to go about that. Like, how do I recruit women? What do I ask them? How long should it be? Where should it be? So the other big thing about this guidance is that we really try to create it as not a, the course is theoretical pieces in the beginning, but more as a practical guide about the how-to or considerations about how to think about things when you're doing this work. So one thing we want to say is that we know that there are multiple ways to consult with survivors. We chose two in particular to think about in this guidance. We limited it to two. We limited it to focus group discussions with survivors and then individual interviews. We also include that with survivor organizations, but particularly with survivors. So we acknowledge that there are other ways to engage with survivors to get input from them, but we really focused on these two methodologies in particular. So that's what you'll find in the guidance document. I'm not going to say a lot about this because this is in part what our panelists are going to say, and we've said a little bit about this, but these are just some of the many examples of why you should consult with survivors. And one of the examples I think I'll just say is that from doing international work, when we travel internationally, we often hear a lot of pride from organizations, systems, people who worked really hard to be much more coordinated in their work. And one of the questions we often had is we want to say, so how's that impacting victims, and how did you engage victims in terms of what you've designed? And that's often a missing piece and really core to how we think about this. So we want to say that for us, this is central in terms of how we think about creating interventions, prevention sort of methods when engaging with survivors. You'll find in the guidance that we include a number of safety and ethical considerations. You'll find examples in the guidance. We tried to give you concrete examples of informed consent, how to do confidentiality, how to think about compensation. You'll see that we take a really strong position that survivors should be compensated for their time in some sort of way. For contributing, we say that should be through, cash. It can be through gift cards, whatever, but we take a pretty strong position that survivors should be compensated in some sort of way, that we think about the space that we utilize quite a bit, and then thinking about the recording of survivor consultations and what to do with them. A recent example that came up with us is that we had done recording of focus groups with survivors, and the government who we were working with, and this was not in the US, but in another country, asked us for a copy of the transcript of the survivor interviews. And we did not tell survivors we were going to do that. We didn't agree with survivors we were going to do that. So we did not provide that to them. We did as we agreed with survivors, but I think it was a good recent example for us about if you are going to record them and have them transcribed, is that we've often done things where we've shared them and had in small committees, shared them. But it's not something we would just sort of email out, that even to our best abilities, when we try and keep survivors' confidentiality, we don't want it ending up on the internet somewhere, or, it just becomes really risky to do that. And so we just kind of held our ground about that as an example as well.
Hey, Melissa?
Yeah, go
on
ahead.
that backside, just on the compensation piece, just a little something else to think about is that when you're writing your grant, if you're writing a grant to do system change work, write that into the grant, figure approximately how many survivors you're going to need. And then also compensation typically for the advocates who are going to have to do the work, contact them, right? So if we write a grant, it's like a $2,000 block that they can charge money to for time to find the women that we need to get into a focus group. So you're not only compensating the survivors, but also the advocates who typically are the ones that are going to find the survivors for you. So
thanks for reminding me of that, Scott. But we did that with domestic abuse project within Metheny that we gave a stipend of money to DAP because they did all the work to reach out to survivors. And so we put that right into our grant. I do want to say that some funders have some weird things about being able to give money out in stipends. One of the ways we've gotten around it is we've just called it transportation costs related to survivors. So I would just a little caution to say sometimes you have to see if your funder has any weird things about that sort of thing, but we do have an examples of how to get around that as well. But thanks, Scott, for reminding me of that. So the other, sorry here, a little touchy on my screen here. Let me try my arrow. There we go. So this is just an example of who should participate. You know, which survivors should participate fully depends on what the focus is. Like, what do you want to learn from survivors? What's the goal of that? So this is just an example of that to think about. We have some sort of guidelines and some examples in the guidance about how to think about the who should participate. A big thing I think is that we want to say that you need to have a representation, a broad representation of women to be a part of your focus groups, and to make sure that you're able to meet the needs of survivors in terms of transportation costs and childcare and all those sorts of things. But having a broad representation is a really, really important piece. So I'm just going to go quickly through some of these things so we can hear from our panelists about some of this. Sorry, my here, there we go. This is just a little bit about the size and the length of focus groups. We've found that 8 to 10 as a maximum is generally sort of what we would say, and then about up to 2 hours in length. One of the things you say was, how many focus groups should you do? How many interviews? Often we'll say until no new big themes have sort of arrived across those. So we don't give a hard, number of that. We find ourselves often doing 3 to 5 to 7 focus groups. It just sort of depends on what the topic is and what the focus is of that work. The recruitment of survivors, just as Scott was talking about, that if you're not an advocacy organization, we always work with advocacy organizations to do this. There's a lot of details in the guidance about the ways to do this, about how to do this safely, how to think about this. Sometimes we worked with community, and when we've gone for sort of a more broad public, we've called it a women's health survey, so that if anybody should see it, they wouldn't, for their safety concerns, wouldn't have any issues in that regard. So that's one thing, but you'll see a lot of examples, and our panelists will talk about a number of these things as well. I just want to point these things out in the guidance. As Scott was mentioning about the compensation also, is that we always plan for food and beverage, for childcare if it's needed, and transportation. We pay for transportation, give compensation for that as well when it comes to directly for the survivors. We, as I mentioned, feel really strongly about this and feel like it's really necessary in terms of thinking about how we value survivors' input into our work and projects. We have a whole section there, was actually mostly written by Laura, about remote survivor consultations. We learned a lot by trial and error, of course, as well, about how to coordinate with local partners, about how to think about having a remote consultation team that you partner with if you're doing it in a remote area, how to think even about, one of the things we didn't think about when we scheduled the time is that in this country we picked a time of day that it wasn't safe for anyone to travel, not just survivors, but it was a really dangerous time in this country. So there's a lot of sort of thinking that we include in the guidance about doing remote survivor consultations when you're doing them online, and the safety considerations that you have to make. And I know some of our panelists have some examples for that as well. We also talk quite a bit about how to think about support for survivors after the consultation, examples of what to say, what to watch for, about available resources, about having trained people available for when things come up really, really important in terms of this work. What we're going to talk about with the panelists, so I'm not going to say much about this here, but there's engaging with survivors and learning the information, but then it's about what do you do with the information you learned? How do you process it and integrate it? And how do you think about how you're going to include that as part of a process? So we'll be talking about that with our panelists today, but we include some examples of that in the guidance document as well. I think the other piece is just also about how you write the report. We have a sample of a report in the appendix, how to think about what you're going to include about the demographics of survivors who participated, about the number, the regions they represented, in particular, the focus of inquiry, and then what you've learned. So we generally often develop a committee to look through these things together and to develop sort of the themes for our purpose and putting those into report. And we'll talk more about those through examples as well. So just a lot of people have said, well, what if we can't do it with survivors? Can we do focus groups or interviews with staff of violence against women survivor organizations? We say, yes, you can learn a lot from what we would call advocates or victim serving agency staff. What we would generally say is it should be an and not in replace of if you can. We really recommend that you do both when you can, that you do it with survivors and with those who most closely work with survivors on a day-to-day basis. There's so much to learn from them about the themes that they see, depending on what your focus of inquiry is, and that you should also pay and give compensation to those organizations for participating in that as well. So what we're going to do now is I just wanted to give that quick overview of it. You're welcome to ask questions in the chat, but we'd like to move now to the process where Laura's going to begin with our three panelists and have them share some of their experiences. Laura?
Great, thanks, Melissa. And just an encouragement to everyone who's putting information in the chat. We love it. It's not rude. To comment on something you're hearing or amplifying, sharing your experience, or if you have a question. So thanks for just makes it richer. And I'll try and keep an eye on that while our panelists are speaking. So as Melissa said, this next section, we'd like our panelists to comment. Really, if you see the question there, I see sort of three parts to that. One is describing your experience. And then second is your perspective on the importance of gathering information and engaging with survivors, or maybe an example of how you've seen it to be really powerful and important. And then the third aspect is really just specifically how you've done it, how you've maybe gone about it, how you've incorporated it into the life of your organization. So those three components. And Methany, if I can pass it to you first, we'd love to hear your thoughts on those.
Sure. So let me know if I don't answer one of the questions. So I will say we've done listening sessions with survivors around their experience of accessing services as a community member and within a community organization, because we were trying to think about what alternatives to a justice response would look like. And so asked them to think about what a community-based response would look like and got feedback from them around that. We worked with the Missing and Murdered African American Women's Task Force to talk about access to justice systems and human service systems around experiencing domestic violence. We partnered with Global Rights Ribbon around some of their work looking at the Minneapolis Police Department's response to domestic violence. And then we've also done listening sessions with both men that have used violence as well as BIPOC providers who have facilitated groups for folks that use violence to evaluate our programs to see how we could make it more culturally responsive. So those are some of the different ways that we've utilized participant voices, both victim survivors and folks that use violence. I will say our experience has been wonderful. I think it's been a privilege to be able to talk with participants in a focus group type setting, just to get their feedback, be able to hear their stories about what it was like from their onset of trying to access a service, all the way through where they are right now. I think it's also been really fulfilling for different folks on our team, myself as the executive director, but also advocates and other team members who maybe didn't get to, based off of the type of work that they do, hear somebody's full story. They just see folks that are in crisis in a specific moment in time. And so they got to hear a more holistic view of someone's experience, and be able to have that to take with them in their work. And then I would say part of like some of the reasons I think are important to do this work is that, you know, at the Domestic Abuse Project, we work with everyone in the family. And so part of our work is working with folks that use violence. And it's really important to center victim survivor voices in that work, to make sure that we're not colluding with our clients or swaying too much to one side of the spectrum. And so doing focus groups is just another way to keep victim voices centered in our work across all of our programs. We also really think about ourselves as another system that holds a lot of power in the way that victim survivors experience support or don't in their environments. And so it's an accountability process for us to be able to hear directly from survivors about what they've experienced and then think about how to implement change within our organization. So moving into how we've done some of that, taking these, the ideas from our participants through the evaluation process that we have in place when folks have said, you know, this didn't work for me, that didn't work for me. We've been able to do that through surveys, but it's different when you can actually sit with someone and talk with them about it. So we pulled together a list of our previous participants, and then brainstormed questions with our team about what is it that we want to learn or need to learn about based off of what's going on in the community or what's going on within our own organization. And then sought funding to be able to provide payment for folks' time, because it is taxing emotionally to share your experience. But a lot of folks want to do it, and so they'll give up on work to be able to come and talk to us. And we don't want to add more cost to folks that have already struggled financially because of their trauma. And got some funding to do listening sessions, and then started talking with our current participants. We reached out to former participants, especially those that had completed surveys, and then also talked with key community partners that could be a broker of trust with us, so that we could get a holistic view of all the communities that we serve, even if we don't have a huge population of folks that we're saying yes to doing listening sessions within the people that were at DAP at the current time. And that was really important to be able to make sure to include different community voices that are actually and very much impacted by our services and the systems that we're a part of, but maybe didn't have access to us in the way that that they should. So that was really important to make sure that it's culturally relevant and responsive. So I will stop there and pass it on to someone else.
Thanks, Mithany. So appreciate that expression of the breadth of reaching out further. And then the piece about, because I think it's tied to your other point about, hey, we need to think about how we hold ourselves accountable a bit, right? That, and it's a different conversation, right? Than case by case or somebody coming in to sit back and say, how is it going, right? And so great insight there. Thank you for sharing that and for all your work. So appreciate that. Scott, can I come to you next and have you kind of go through those same things with your work in Duluth, your experience with it, your perspective or examples of the importance and how you've done it, and maybe as part of this, answering one of the questions that has come up in the chat about a little bit the composition. You know, would we ever put survivors and advocates together, or just how we think about the composition of groups?
Sure. I actually just tried that for the first time and it didn't work so well. So yeah, I have some experience. So just to build on what Amrithini was talking about around this idea of centering victims, you know, I'll go to a community and I'll say, well, we have a victim-centered response. And I say, okay, so what are the survivors in your community saying about your response, and how have you centered that? And it's like crickets, because they haven't actually, I mean, the whole reason we're doing everything we're doing is to serve a group of people, but we're not in conversation with them. So how is it possible then to center them if you don't have any input, any understanding of what their experience and what the end game is for all of these things that are happening in the community as a response? So, you know, it really, I think, just changes, hopefully, how we think about what it means to be victim-centered. But on this, I did a focus group just recently where our advocate was sitting in, and the advocate knew everything about these women. That was her advocate. So but I don't know anything, right? So I'm trying to understand how their lives have been impacted by certain interventions. In this particular case, it was child protection. So as I'm trying to go through, the advocate was jumping in to talk to the survivors about, well, remember when you did this? And you should talk about that. And there's such a strong bond between the advocate and that it almost made it, you know, difficult to get to the system stuff, because it was focused more heavily on their personal story. And that's just one of those things where if you really want to, so like, for example, you could sit down in a focus group and say, tell me about your experience with violence. And you're going to get a lot of information about what the impacts are on individual survivors, right? I've done those focus groups. You get 50 pages of transcript, and you might have 1 page of which you can use for system work. It's a different way of interviewing to get to how the system has responded and what the corresponding impact is. And then they did this, and then what was the impact, so that you can really get that kind of understanding of how the system is doing something that is helpful, that we don't want to lose, and is doing something that is undermining somebody's safety when they respond. So it's just a different way of interviewing, different kinds of questions that you might ask if you're looking for information on a system. So here's an example. We had some agents, probation agents in our community, who went to a conference, and they heard about this idea of agents going out on high-risk offenders and doing surprise visits to check to make sure that they're following the conditions and all of that. So they were all fired up, and they all wanted to do this. And I said, okay, well, here's the thing, right? We need to go talk to women first about this idea. And they said, well, yeah, but I mean, they're doing it here, and it's really, I know, I'm not disputing it's a good idea, but how we do it should be guided by those that are going to be involved in it. We don't want to make it worse, right? So we do these focus groups, and we said, okay, you know, the idea, right, of probation agents going out, and 100% of the women thought it was a good idea. Like, there wasn't one woman in a focus group that said, no, that's not a good idea. So they wanted that kind of accountability. He said, okay, so if they walk into your house, what should the agent be, you know, what should they be doing? What should they not be doing? Well, the first thing they shouldn't do is bring me into the conversation. I may be there, but don't talk to me. Don't ask me questions, because then you put me on, you're there to see him, right? You want to talk to me at a different time, but don't talk to me in front of him, right? Focus on him. Second thing is, if we've got children in the house, take him to a different room. Don't have the conversation you're going to have with him so that my kids can hear that, okay? And then I asked a question. I said, well, what if the agent comes over and he's not there, and you are? Does that create any discomfort? Do you have anything, you know, thoughts about that as far as what we should be accounting for if he's not around and they're showing up. And most of the women said, you know, we welcome you showing up. And one of them said, well, I can show you where his stash is. Because in our community, if you're on probation for domestic assault, you have a no use alcohol or non-prescription drugs on your probation contract. So I can show you where his stash is. So then I said, well, how many of your partners have a stash? And again, almost every single hand, I think all of them actually went up. So, all right, what would have to be in place for you to feel comfortable showing an agent where his stash is? Well, they'd have to have a relationship with me before they showed up. I mean, they're just not going to show up and I'm going to say, hey, he's got some pot stashed in a drawer, or he's got some alcohol hidden under the sink. I'm not going to tell you that because I don't trust you. You're not going to sell me out. So you need to put the work in to develop a relationship with me before you show up. And then if I think you're an ally, then I might do it. But if you're going to get them on it, you can't get them on it that day. You're going to have to come back a different day and you're going to have to find it, right? So none of this was in the training that they went to. And we incorporated all of it into the way that they respond. So now we go out, right? We do the next step. After we get victim input, we put it in place. Now we actually test it and see, does it work? So the very first one we go to, agent goes in the house, we get in there, he's there, there's kids, does a good job, moves them to the kitchen, kids are 2 rooms away. And then a woman walks in, which is his partner. We didn't know that at the time. He did, the agent did, I didn't. And she just leans on the door frame and looks in. And the agent looks at her and says, oh, are you so-and-so? How are you doing? And, or no, how is he doing? And I looked at him and I thought, what are you doing, dude? Like, this is the thing that he said not to do. And what did she say? Well, he is doing fantastic. He is doing every single thing he's supposed to do. He couldn't be, but he wasn't doing a single thing he was supposed to do. Not one thing, but what was she going to say? Right, with him standing there, right? So it was like a really good example to bring home exactly what the women were saying and why they were saying it, right? Don't bring me into the conversation. Another situation, the woman shows him where the stash is. Now, this isn't one of the women in the focus group, somebody else shows him where the stash is. It's a vodka bottle in a tin garbage can in the basement. Agents have never been in the basement, right, up to this point. So they leave, he's not there, they leave, they call and they say, hey, we were over, you weren't there, we want to meet you at your house. And he said, okay, 2 days from now, whatever. So they set up the meeting, they show up and they said, you know, I've never looked in your basement before. Because they always look through the fridge, they look through, you know, the cupboards, that kind of thing in the upstairs, but they never went in the basement. I need to go in your basement. Okay, sure. Leads them down the basement. And there was a little cupboard there. And the agent opened up the cupboard. And when he did it, he tipped over the tin garbage can and the bottle rolled out. And he goes, well, what's that? Right. So, I mean, it's a way that you can control for, you get the input from the survivor, right? But you don't sell her out. You find a way to find whatever it is that she wants you to see, because the alcohol consumption is making her less safe, right? That's what she wanted him to do, get rid of that stuff. So those are some examples where you take a response that was developed by a community, high risk visits for those on probation, and build in a way of doing it that enhances safety, doesn't undermine her safety while they're there, right? And is able to hold him accountable at the same time. So, yeah, so I'll just stop there and let you go to the next.
Thanks, Scott. Such vivid examples of how powerfully important it can be to kind of hear those, you know, real world implications of our policies, right? And then be able to create behavior. So I really appreciate that. So I want to move on to you, Alicia. I think you have the sense by now. If you could talk a little bit about your experience about it and why you think it's pretty important, and how you've been involved working, how you literally have done focus groups or hearing from survivors.
At Equality Bahamas, one of our key things that we do is to ensure that we're not just sitting around tables and making decisions by ourselves as volunteers or experts or researchers, but going directly to survivors and making sure that they're a part of solution building. So of course, interviews and focus groups are incredibly important. And it's really important that we set them up in ways that make it possible and make it feel safe for survivors to be able to share. But one of the things that we learned in the last little while is that we always have to be prepared for the unexpected and to be ready to change course a little bit and change the design. So in our most recent research, it was supposed to start around the same time that the COVID-19 pandemic got started. And it meant that we could no longer do interviews in the way that was planned. We were supposed to be doing door to door. And it just wasn't possible. And for a while, we put it off until we made the decision to switch to doing it virtually. And this is a project that we worked on with Global Rights for Women. And we took some time to think about how we could make this safe and how we can make this an effective means of collecting information. And of course, it meant that we had to ensure that the people that were conducting the interviews were particularly trained to look for and listen for certain things, not being able to see body language, not being able to see what is going on, where the survivor or respondent is, means that you have to be really listening and using things like tools like safe words, listening for those words and knowing how to respond when the safe word is used. And we had to do all of this pretty quickly because the project had been put off for such a long time. And then using those interviews as well to select people who could participate in focus groups, recognizing that you really do get different information in these two settings. So some people might say, oh, we'll interview a certain group of people and then we'll bring another group of people to focus groups. But when people are together and they have shared certain experiences or they've had sort of similar experience or even very different experiences and they're hearing from other people, it can sometimes be a lot easier to open up, but it could also bring up other memories and other key points that didn't come up when they were just simply answering questions that were set to them. And it's quite different to have a discussion than it is to just question, answer. And for us being in the Bahamas, we always have to think about, everyone has to think about context, but for us, that means thinking about the fact that we live in very small communities. A lot of people know each other, if not by face, by name, or you know that this is so-and-so's granddaughter. This is this person's son's ex-wife. So it means that we have to work really hard to ensure that people feel safe in talking to us and that they know that there is confidentiality. But it also means that when people show up to a focus group, we're attentive to what the room is looking like, what people in the room look like, because someone might not come to you and say, that's my ex's or my partner's sister, who's in the room with them, or this is someone who goes to my church and I don't feel comfortable. Sometimes there's things that we need to be able to pick up on so that we can tell someone, if you want to come back another time, then that's okay. Or, you look like you're in a rush. Do you want to go and do something else? And maybe we can reschedule for tomorrow. Paying attention to these little things really matters, and not putting it on survivors themselves to constantly have to assert themselves and speak up for themselves, while we do realize that they have agency. And I think it was also important for us in this last exercise to have in mind the idea of constant learning. It can get really difficult to stay open and curious if this is work that you've been doing for a long time. If you've been studying for a long time, if you're really steeped in theory, if you've worked with a lot of survivors, you can get this idea that, oh, I've heard it all. I know all the issues. I know how everyone feels about everything, but it's just not true because we are all so different. People are so different. For us in the Bahamas, we are a majority Black country. What does that mean for people who are not Black? Or what does it mean for people who are migrant people? So they're Black, they may identify as Bahamian, they may have citizenship, but be viewed in a different way because of their last name. Their last name might indicate, or their accent might indicate that they're from another country, and that can affect their access to resources. Can we assume that people have the same access and have the same experiences and have the same thoughts about those experiences? No, we have to ask these questions. And another thing that I thought was really interesting was that there's this big difference between asking leading questions, which we never want to do, and then asking follow-up questions that probe. So you might want to get something out of a discussion, out of a question, but you can't ask the question in a way that leads the person to answer in that way. So you want to ask questions that are a bit bigger. And then if you see a theme coming up, if you hear something that's not being said, you can come back with a follow-up question. You can probe a little bit. You can ask for the person to tell you a little bit more about that experience. And I think that's a really key thing to remember, the difference between those things, because it really does change the outcome, and it ensures that we are staying open and not coming with particular expectations, but creating a space where people can share very key takeaways and insights and experiences.
Lisa, thanks so much. I heard 3 tensions in what you said that I think are so apropos for doing the work, that, that ability to kind of think ahead and set conditions, and maybe not have the burden on people entirely to tell us I'm uncomfortable or this is going not the way I expected, but also recognizing their agency and not, excluding their ability to do that. So that's something we creatively hold. Maybe along with that is if you have a lot of experience or studying, how do you use your wisdom and your experience, but also stay very curious and open, right? Because we also, even in our knowledge, but also just don't want to project that, like, I've heard it all, you can't say anything new, right? Because that'll come across. And then the third one about sort of, general versus specific, like how do we give the open as much as possible, but like in Scott's examples, be able and willing to probe pretty specifically, especially if there's a policy or something at work, but do that in an artful way so that we get the benefit of both, or don't lead somebody in a direction that we're kind of hoping they'll go, right? So great examples of creative tension and all those things that you shared. Thanks so much. So what I'd like to do now, I thank you for people who continue to share things in the chat. We'll weave them in. I'd invite any of the, I see Melissa answering, I'm answering as we can go, but if presenters or panelists want to say something as we go, feel free. We're now going to move into kind of the challenges and benefits, and give each person a little more time to talk about that, and at the meat of it, now that we have examples of why it's done and how it's done, kind of some more about some of the challenges and benefits. Some of this has been touched on, but so Mrithani, can we start with you? Any insight you have on the challenges and benefits from your work at the Domestic Abuse Project?
Absolutely. I think to keep going with something that Alicia was talking about, I think being really clear on what the role is of the folks that are in the room. So I think many of us are advocates at heart, and so we are walking in having those pre-thoughts about what the reasons are and the outcomes are, but that our role really is to listen. And so making sure that everyone else that's there that maybe doesn't have as much experience doing focus groups or like holding that also knows like this might come up for you. And so these are things for you to be thinking about so that you can hold to your role. I think along with something else that Scott made me think about too, like being really clear on like what is the purpose and what are the questions that you're asking so that you can keep the group on task, because everyone will delve into all kinds of details about their experiences. And that can take up 3 focus groups before you actually get to the question or the topic that the group is about. And so thinking about how to structure things and how to really prep your focus group attendees so that they also know what their role is. I think creating safety to get folks to the group and think about what kind of barriers might be coming up for the different populations that you're trying to connect with so that you can address that and write that into your grant. And also think about how that's going to affect your timeline. Sometimes it can take a long time to get people lined up to actually talk to them. And it takes a lot of work to build that trust in community, or to build that trust with community partners, because they're the ones that are going to get folks to group. Along with that, something that we experienced was, and I saw Pumalani, I think someone's here from there. Shout out to Pumalani. They're an amazing organization in Minneapolis that works with the African community. We were working with them, and there were a lot of folks that showed up for a listening session, but not everyone spoke. And we had to really have the flexibility that there were going to be folks that were there just because they wanted to see, what is this focus group about? Can we really trust the folks that are coming here, and what they're saying they're going to do with that information? Or because of where they were in their trauma story and their healing journey, they just weren't ready to use their voice in that way. And so they showed up to the listening session. We gave them space just to be there and to listen. And then they either showed up for a second listening session or met with us individually, because that was what they determined was the safest way for them to participate. And we had to be flexible around that and have the capacity to schedule and pivot along with the folks that were attending. So I think those are the things that came up for us around challenges. And then one last thing I wanted to mention, Melissa, that you had talked about with working in other countries, and the request for the transcript of everyone's responses. I think also depending on the country that you're coming from and what's happening politically, and how folks speaking out can be perceived. Also thinking about, what is the risk to the survivors? How might they be? I come from a torture trauma background. And so really attending to the impacts after you're gone and not there anymore to the folks that are engaging in your process, so that it's as safe as possible. So like understanding the political climate, I think is a challenge and really important when you're doing focus groups. As far as the benefits go, I know one of the concerns folks said is that it's re-traumatizing. I think if it's not structured well, and if you're just going in and trying to do something off the cuff, it has the potential to be. But if you have intention, it can absolutely be this beautiful place for mutual aid, where victim survivors are able to come together and have a different kind of experience with each other. We really saw that in our listening sessions. We saw folks move from being a victim to being a survivor to being an advocate for themselves and for other folks that have experienced domestic violence. We had survivors reach out to us after the focus group and say, hey, I want to do that again. I want to talk to other survivors. I want to talk to your staff. I want to go to the government, and I want to advocate for policy change. And it gave them an opportunity to practice using their voice in a safe way so that they could feel empowered to want to move forward and share their story in other spaces. We also heard examples and details about folks' experiences that we didn't hear through providing services. And we got to have a 10,000-foot view of each individual victim survivor's experience, because people would come and talk about what it was like from day one up to 5 years later around their experience. And that's just hard for us to do sometimes as providers. We can get into the day-to-day with our participants and not always step back and think about what has this collective experience been like for them. And so that was a benefit for us. And I think it also really helped folks integrate their experience, which made it a healing experience for them to come and have the opportunity to do that work with other folks and in community. And that's another benefit. I think as providers, we can be isolated in the work, and our participants usually are isolated in their experience, and it created a community and a healing opportunity as a collective for the folks that we were working with. I think it drives community-driven change. It is powerful to go to legislators and council members and funders or your board and say that you want to implement change, and here are all the voices of the people that we serve who are the most important voices to lift up. And for someone to say no, then they're saying no to the population that they're supposed to be serving. And so as an executive director, it's been really a powerful tool to implement change in our organizations. And then the last thing I will say is a benefit, especially with working with folks that use violence. When you're working with folks that are maybe resistant to an idea that you want to put out there, it created an opportunity for co-ownership over change making that maybe they wouldn't have had the opportunity to participate or engage in before. And so thinking about the BIPOC listening sessions that we did with participants, we got to say, hey, you know, what was your experience like for folks that graduated our program? And we also reached out to folks that didn't make it and asked them what the barriers were from their perspective to actually be successful in our program. And that led to folks being more invested and potentially coming back to us down the road if it was something that they needed again.
Thanks so much, Marathini. That's great. Scott, challenges and benefits, conducting of interviews, focus groups, hearing from survivors.
Well, next time I want to go first. Everything he just checks off all my boxes as I go down the road. All right, so the challenges, I think, to go to one of the questions that came up was just, you know, what do we ask? You know, how do we ask the questions and how we come up with that? Essentially, if and most of the focus groups that I've done are about different kinds of government responses that we're trying to understand. And so essentially you want to know, are there things that when you intersect with that agency, are there things that they do that are helpful and are there things that they do that are not? And why not, right? Essentially, that's the big picture, right? So it might look something like this if it's a criminal justice response, right? So my understanding in this room is that everybody here has called 911 for help around a domestic assault case. So, you know, could I start here? When you called 911, what were you hoping was going to happen? What did you need to happen, right? And then she says whatever that is. And then the next question is, okay, did that response meet that? Why or why not? And then if you could redesign it, right, to a way to fit what you were calling for, what would they be doing different, right? Like, and that would be, and then you just go around the room, and as Alicia said, those conversations remind other women of things, and then it just builds as you go around the room, and then the themes begin to emerge amongst the women who are having a conversation about this experience, this common experience of intersecting with this particular system. So that, you know, it's really, there's the questions that you want to start are really probably not the struggle. It's how do you follow women's stories once they give them to you to extract as best you can what you need to bring back to that government system and help design. And as Amrithini said, there's nothing more compelling to move change than to say when your system, when your agency intersects with these folks, this is the downstream impact, right? That may not be what they thought it was, and that opens them up more for change than if somebody who's just the expert comes in and starts talking to them about what they should do. You know, an example, you know, as far as the benefits might be talking about what, you know, we would have missed if we didn't do it. So we were doing some work with around 911, and we sat down with a prosecutor, law enforcement agency, advocates, call takers, dispatchers, and 911 supervisors. And we listened to 20 911 calls around domestic. And the request was to pick every fourth one in a time period so that they were randomized as much as possible. And then we just listened. We had no agenda going in other than to just hear what we heard, right? And one of the things that we heard was a lack of, we heard a lot of things, but one of the things we heard was a lack of engagement between the call taker and the survivor calling on the phone. almost to the point at some points where there was an argument. So so as an example, a woman's on the phone, she's in the bathroom, it's late at night, and she's whispering. She's running the sink, she's flushing the toilet because she's trying to make sure that her partner who's in the bedroom, in bed, doesn't think she's calling 911 on the phone. And so you can just feel in the room, everybody is on the edge of their seat because we don't know what's going to happen here, right? And the call takers, she says, you need to get somebody here right now. I'm in the bathroom. He doesn't know that I'm in the bathroom. And so could you get somebody here right? Ma'am, I need to know how to spell his name. Can you please spell his name? And they're like, I don't have time for this, okay? Just get somebody here. Okay, but what you have to understand is that 911 is responsible for the safety of the officer going in there. They need to know who they're walking into that house with, right? To make sure that they're safe based on who this offender is, or maybe they don't know, but if they do, right, they have a way of dealing with him, right? So there's a responsibility they're trying to control for, but they don't know how to do it because they're just doing it like they do with everybody who calls. So when we sat down with women in focus groups about 911, the biggest thing, hands down, that they wanted to know when they were on the phone with the call taker was, is somebody on the way, right? I'm calling because I want somebody to my house and I want to know if somebody's on the way, and nobody was telling them that, right? So we went back and looked at the call logs, and all the call logs had patrols dispatched within 20, 30 seconds tops to the house. So somebody was on the way, they just didn't know it. We said, if you knew somebody was on the way, then what, right? Like, now you know somebody's on the way, right? Within 20 seconds of your call, then what? Well, then I can, and I'm just going to use their words, right? Then I can focus on the stupid questions they have that they need about, like, how to spell his name. So anyway, we took all of that information. We went back to 911. We redesigned the way that they take up these calls. And then we went back 6 months later and listened to a same group, another 20 calls. And it was completely different on how they engaged with survivors and let them know somebody's coming. You could just see the change. In fact, a woman actually called me just completely randomly and said, by the way, I just talked to 911, and I have to tell you, that was unbelievable. It has never been like that one. This is exactly what we want, right? But we would have not known any of that, right? What is the number one thing that she wants to know? She wants to know somebody's on the way. That was not on anybody's mind. None. Who are the experts around the table? To Alicia's point, you do this work for this long, you think you know, you don't know. You don't know what it's like to be on the other end of that phone, making a call at 2:30 in the morning and needing help, right? And that's the experience that you're drawing from to build a better response within a government system. So, yeah. I'll turn it back
Thanks,
to Laura.
Scott. Thanks, Scott. That's a nice segue right to you, Alicia. I'm gonna toss it to you. If you could speak to taking it from there, the challenges and benefits.
Yeah, I think the first challenge that always comes to mind that I'm always concerned about before we start, particularly in a focus group, is building trust in a really short period of time. We don't get anywhere unless the people in the room trust us and also trust the other people in the room and have the understanding that, what is said in this space stays here. We have the expectation that no one is going to go out there and talk anyone's business or, participate in gossip, and that they will be able to share without judgment. And a short period of time, if your focus group is an hour and a half, it's really hard to do. But there are some ways to build it in. So one of the things that often happens is that people arrive at different times. they kind of stagger in. Someone comes 10 minutes early, someone is 2 minutes early, someone is 5 minutes late. And this kind of gives you time to talk to people one-on-one and then slowly bring people into conversation. And we're used to doing it. We do it all the time. How are you? How is your day? And it just means going a little deeper sometimes. So if someone says, oh, today's great, it's great. You know, you don't want to just leave it there. You might say, wow, what made today so great? And then trying to find something to connect with so that you're making a human connection and you are almost giving evidence of your ability to be empathetic. And doing that as people come into the room and slowly bringing people into conversation. And then you can sort of ease in and say, well, you know, we're at such and such a time now, so we're going to get started. And at this point, people will sort of sit up like, okay, we're getting to the business, but they already have the feeling that they kind of know you, you kind of know them. And this is going to be a space where they can share and be honest and feel good about it. Another challenge that I found is the unexpected. I mentioned this earlier. You just don't know what is going to happen. But after you've done it a few times, and if you talk to a couple of people, you kind of know some of these unexpected things, so you can expect them and plan for them. I think Melissa mentioned it, that sometimes people will show up with a child. What do you do in that case, especially when you know the kinds of conversations that you're going to have, the questions that you will ask? There are certain things that nobody wants their children or any child to hear. So how do we handle that? Do we make sure that we have a room where there are some toys and things to engage children? Will parents be comfortable with their children being in a separate room from them? Sometimes that's just not an option. What does it look like to have a child in the same room that you're having the focus group discussion? Is it big enough that the child can be sort of away with another adult and be engaged in their own thing while we're still having this discussion? And the adults also, who are not necessarily that child's parent, don't feel like they have to censor themselves or limit what they say or how they share with you. Because a big part of getting this information directly from survivors is being able to pick up on the nuances, and the language that is used really does make a big difference and gives you a sense of emotions and feelings and how they are looking back at events that have taken place. Another thing, it's sort of a challenge and a benefit at the same time that I think about a lot, is having a space that is hopeful. And that can sound sort of foofy or woo-woo, but you have to give a reason for people to be in this space. And it can't just be that somebody is coming here to unearth all of their trauma and all of the worst things that have happened to them. Why are we doing this? Things exist in a particular space and are happening in a particular way. And then there's another way that we want things to be. And in this room that we're sharing together, we're sitting in that space of hope and understanding that there are possibilities, and the conversations that we have now, the things that survivors are sharing, you want to make clear to them, are the things that are going to turn that hope into something real and get us to that place that we know is possible. So being able to do that without being too sort of woo-woo or sounding fake, right? But making it a real thing for people to hold on to throughout the process. An unexpected benefit, largely because I did buy into that idea that talking about experiences would be re-traumatizing. An unexpected benefit, I think, is that people feel really empowered when they talk about what happened to them and what didn't go so well when they tried to report or they tried to get support. It's very difficult, and people may cry and have expressions of other kinds of emotions, but generally at the end, people will even say to you, I feel so much better. I am so glad I got to say this. And for a lot of people, it would be the first time that they've ever told the story. And for many of them, they know that other people have told the story from a different perspective and framed them and events in a different way, but now they get to share it with you and they get to own it. And in many cases, they get to leave some of those things behind in that room. So I think it's challenging for us, but we have to not underestimate people's agency and also their ability to reclaim their power by sharing their stories.
Thanks so much, Alicia. Appreciate that. Melissa, let me pass it off to you. And for those of you, I noticed some people in the chat needing to go. We will hear from Melissa, and then we'll move. I think you've heard a lot of really rich themes. We'll move to some of your questions before we wrap up. So go ahead, Melissa.
Yeah, I think just a couple of things just to add. And I think for what you're saying, Lisa, about that, one of the big benefits is the number of women who have felt empowered. I mean, just even the way in which people come into the room, their demeanor, their body language, just really, I've seen brighten up by the time that they've left. And it's like a transformation in some sort of ways that you see women go through. I think that one of the other things is I've seen a lot of women be inspired to want to join a support group in the future. I remember doing one with Alicia in the Bahamas, and a woman said, I've never sat around with other women before. Are there these kind of groups here? And Alicia is like, yes, there are, right? So I've seen a lot of survivors wanting more of that sort of engagement with other survivors. And I think that that's been a huge benefit for survivors, I think, as well. I think just a challenge has less to do with the groups, but more with about how the system responds to what survivors say. I've seen quite a bit of resistance by the system wanting to disregard or to say, oh, well, that was just a small group of women, that you talked to. And that's, I think, for me, been a bigger challenge than anything. I remember in a particular place that police department had just made a huge change in their policy. And we had just done focus groups with survivors about their experience with the police. And when we talked to the police leadership, I mean, these survivors all had horrible experience with the police in this community. I mean, really awful. Some of them called them corrupt. And so when we gave the feedback to the police, one of the things the leadership said as well, we just changed our policy. You must have talked to survivors who only had, contact with the police prior to this date, and he gave a date. And I said, well, out of curiosity, I'm happy to check because it's one of the things we ask survivors. And so, I don't think it would have mattered either way, but it was an example of how the police leadership in this community thought because they had made this change to their policy, that things had dramatically improved. And it had not. These were all survivors who had contact with the police, after this big change in their response. And it was really hard for this police chief, and he wanted to just completely disregard it. And so I found more challenges and resistance from those about what survivors have to say or wanting to give sort of justifications for it. And so what we try to think about, to Scott's point about, is to focus on the input of what survivors say would be helpful into making those sorts of changes about survivors' input about what would be helpful for them going forward. And then just the last benefit I would say is that you just learn so many things about survivors' experience that you wouldn't get had you done a focus group. And one example is I did focus groups with survivors who were arrested. So we would call criminalized survivors here in the state of Minnesota. And one of the most consistent things that survivors said, so these were survivors of battering who had committed an illegal act and ended up having a same or harsher sentence than their partner did. But what survivors said is that once the system got into their lives, that the sexual violence they experienced from their partners increased as a result. Because what their partners would say to them were things like, well, if you don't do this thing that I want you to do sexually, then I'll just call your probation officer and I'll tell them that you've been drinking. And I'll figure out a way, right, to make sure that you get in trouble and you go back to jail. Or I'll make sure to call the police on you again because now you have a record and I don't. And so survivors consistently talked about a lot of sexual violence coercion that they were experienced that we wouldn't have heard of had we not done those interviews. So I'll leave it up there.
Thanks, Melissa. And thanks to all of you. I know we have so much we wanted to get to. in particular, there are considerations on how to use the information and pull themes and write reports that also have to do with both safety and to the points made several times today about really how it might shape and change policy and practice, as well as Anthony reminds us the political context. We don't have a lot more time, so please do go to the guide. I do want to see if there's any outstanding questions right now that someone wants to put in the chat. We've tried to answer a number of them along the way. I'm trying to look back at my notes to see if there's any, but those of you who are on the panel, you might have seen something come by that you want to speak to. If you have, let me know. Otherwise, I can pose a question.
Yeah, I think, Laura, there's a couple in the Q&A particular
Okay,
maybe that
perfect.
we should look at. I think the first one is, is an important one. Did any sort of ethical board approve this study? So I think one of the things to know about this is that that many people will think about this similarly to the process about what would be in terms of academic research and requiring that sort of review. And so in terms of our guidance, we did have people who have been a part of those review our guidance in terms of making sure we covered a number of the bases. I think one of the things to think about is what is the purpose of this in this sort of way, and what's the scope about what we seek to learn is often very different than what you'll see in a lot of sort of academic research in terms of what you're doing. I mean, part of what we've sort of said is that, advocates do this all the time where they sit around with women and learn what they're doing, right? And so in part, we're trying to think about is there's what survivors experience, and then there's the help or lack of help. And we're trying to understand what the gap is between what survivors need and what kind of response they get. And that's kind of like an overall way to think about it. And so what we would generally say is we try and have a committee of people in any community think about, we did this with Anthony and with Lisa, what's their scope? Who are we going to reach out to? What are we going to say? What are we going to cover? So there is prep, that happens. What is the caller going to say when they recruit people about this? And we've tried to include all of that in the guide.
Thanks, Melissa. The other question that was in Q&A is a bit like that. I don't know if you feel like you want to add anything else or anybody else does about, getting IRB approval before submitting a grant proposal on research and effective intervention.
Somebody else want to respond?
Well, clearly none of us do it, so. I mean, it's really, again, like Melissa said, it's about what we're trying to figure out. We want to know when social services walks into the house, what is the impact on survivors, right? It isn't, this isn't going to be something that normally, I mean, I don't know, somebody might be, but we're not looking to publish this at all. We want to know what it is. And so, like an example, one of the things social workers here 5 years ago when we started this work with them, were doing is they were walking in the house and they were saying to women, my job is to come in and make sure your children are safe. And immediately the relationship was done, right? But we didn't know why from their perspective. So when we did the focus group and we took these common things that social workers are saying to them, the women just about levitated off their chairs when I phrased that, right? And it's like, who the heck do they think they are? I have been standing between my kids and him, and they're coming in here who don't even know my kids and telling me that they're here to protect my kids. They don't know, right? All this kind of thing. So then we said, okay, what their job is they're charged with the responsibility of making sure children are safe. How could they say this to you in a way that you could hear it and not be offensive, right? So the women then brainstormed a response. We have a 3-page sheet, say this, not that, of common things that workers would say and what survivors say. You know, if you're going to say that, this is a better way to say it, given who you're talking to, right? That's what we're trying to figure out on the ground, applicable ways of making whatever system that is intersecting in their lives work better for the survivors. And that's really the scope of most of the work that we're doing.
Others, Anthony, Alicia, thoughts? Last thoughts or comments about that?
I was gonna say, I think the thoughts that came to my mind are like, it's another system that makes it a barrier to listen to victim survivor voices, because it's also really expensive to get IRB approval. And so if that's something that you wanted to do, like make sure that you're incorporating that time and the money into your grant application so that it is a sustainable ask for your organization.
Thanks for saying that. It is another way of stopping the work. Yeah.
Yeah, I just noted too that, and somebody may have said this already as I'm moving between, but I think you can elevate the spirit. If it's not required by a funder, you don't have the time and money, but you're approaching things with sensitivity and all the safety you want, then we still take the spirit of it. What's the potential impact going to be for participating? Are there risks? Are there benefits? And we always include a consent form or talking that over with people. So the spirit is there. And then, as others have said, if it's not unprecedented, but if it's not necessary for your funder or your project, then you can uphold the spirit of it without having the extra work, essentially. So I'm looking at the time, and gosh, it has flown by. I don't know about all of you. Such rich insights. I hope people can go ahead and get the guidance. Again, we put that text in, that link in a few times. It'll be in the recording that will go out as well. I want to thank each and every one of you for joining us today, and a huge and special thanks to our panelists who are, as you have seen, are incredibly knowledgeable, and I hope have inspired you to think about the ways you currently hear from survivors, and even those of us who are working with survivors sort of every day, the point about sort of a different kind of consultation, a different kind of listening, and to a different end potentially with particular policies and procedures or training that we might be doing and centering that work. So any last comments? Otherwise, we're at time, and I just such deep appreciation to each of you and all the work that you're doing. I've learned a lot, and I hope our participants have as well. So any final thoughts? Anybody?
No,
All
just
right.
thank you, everyone.
Thank you so much. Enjoy your day. We'll stay on just a little bit for people to grab links or